In the United States, depression is typically diagnosed through a combination of clinical evaluation, patient interviews, and standardized assessment tools. The diagnosis is guided primarily by criteria from the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. The clinician will assess emotional and physical symptoms, duration, and impact on daily life. Common depressive symptoms include persistent sadness or low mood, loss of interest or pleasure in activities once enjoyed, changes in appetite or weight, sleep disturbances, insomnia or hypersomnia, fatigue or loss of energy, feelings of worthlessness or excessive guilt, difficulty concentrating or making decisions, psychomotor agitation or retardation, thoughts of death or suicide. DSM-5 criteria includes to be diagnosed with major depressive disorder, MDD, the patient typically must meet the following criteria. At least 5 of the 9 symptoms must be present during the same 2-week period and represent a change from previous functioning, with at least one symptom being either a depressed mood or loss of interest, pleasure. Symptoms should be present for at least 2 weeks. The symptoms must cause significant distress or impairment in social, occupational, or other important areas of functioning. The depressive symptoms should not be attributable to the physiological effects of a substance or another medical condition. Clinicians may also employ structured or semi-structured interviews or screenings to ensure consistency and thoroughness in assessment. To rule out medical conditions that may mimic depression, such as anemia, a healthcare provider may perform a physical examination and run laboratory tests, for example, thyroid function tests, as needed. Some treatment options include selective serotonin reuptake inhibitors, SSRIs. Some examples include escitalopram, Lexapro, sertraline, Zoloft, fluoxetine, Prozac, paroxetine, Paxil. SSRIs work by increasing the levels of serotonin in the brain, which is believed to play a key role in mood regulation. Common side effects may include gastrointestinal disturbances, sexual dysfunction, and insomnia. Serotonin norepinephrine reuptake inhibitors, SNRIs. Some examples include venlafaxine, Effexor XR, duloxetine, Cymbalta. SNRIs enhance serotonin and norepinephrine levels in the brain, which can help alleviate depressive symptoms. Some side effects may include nausea, dizziness, dry mouth, and increased blood pressure. Tricyclic antidepressants, TCAs. Some examples include amitriptyline, nortriptyline, imipramine. TCAs work by inhibiting the reuptake of neurotransmitters such as serotonin and norepinephrine, increasing their availability in the brain. Side effects can be more pronounced and may include weight gain, drowsiness, dry mouth, and constipation. Due to safety concerns, they are often not the first line of treatment. Monoamine oxidase inhibitors, MAOIs. Some examples include phenelzine, Nardil, tranylcypromine, Parnate. MAOIs inhibit the enzyme monoamine oxidase, which breaks down serotonin and norepinephrine, leading to increased levels. MAOIs can have serious interactions with certain foods and medications, for example, tyramine-rich foods, and may cause side effects like orthostatic hypertension and weight gain. They are generally a last resort due to the risk of dietary restrictions. Atypical antidepressants include bupropion, Wellbutrin, mirtazapine, Remeron. These drugs use various mechanisms. For example, bupropion affects dopamine and norepinephrine, while mirtazapine increases norepinephrine and serotonin. They may have unique side effects. Bupropion can lead to insomnia and increased anxiety, whereas mirtazapine may cause sedation and weight gain. Treatment should be individualized, taking into account the patient's specific symptom profile, medical history, potential side effects, and personal preferences. Antidepressants usually require several weeks to show effectiveness, and continuing treatment for several months is often necessary to prevent relapse. Regular follow-ups are essential to assess efficacy, manage side effects, and make necessary adjustments to medication regimens. In some cases, combining medication with psychotherapy has been shown to be more effective than either treatment alone. The pharmacological management of depression is a critical aspect of treatment that requires careful consideration of medication options, ongoing monitoring, and collaboration between the patient and healthcare provider. This approach aims to improve patient outcomes and support overall mental health recovery.